Gender inclusion, integration and involvement is of prime focus in today's day and age. Health is an integral and innate fundamental right which everyone has the propensity to enjoy. Oral health is an integral component of general health and overall well-being. So, in the spirit of universal health coverage and in line with the Sustainable Developmental Goals by the UN, inclusion in oral healthcare practices is imperative, and it is of prime importance to maintain a safe space for such individuals to come and seek positive healthcare. So the transgender persons, of course, have been a legacy and have a rich cultural, traditional lineage in the Indian scenario as well, as we all know in the scriptures till today and in today from various epochs till today's day and age. However, we as dental care professionals or oral health care professionals need to be sensitized regarding the importance of including and integrating transgender care in our regular dental care practices. There are several issues of affordability, accessibility, awareness and acceptability for the transgender community when we look through the lens of oral health care. When we are talking of such individuals, it is very important for us to understand that there are certain transgender persons who may not be able to afford the dental health care. There may be certain others who are innately absorbed in cultural practices where the gutka chewing and supari chewing is of great cultural importance right there. So, as we know, tobacco consumption is at a very high prevalence. Studies have reported, action research has reported that there's a high consumption of tobacco, whether it's the smokeless form in the form of gutka or mishri or mawa or pan masala, or whether it's in the smoked form when we are talking about bidis or cigarettes or even hookah. So these are cultural practices which have been reported, and as we know, there's a direct link with an increased amount or increased prevalence of oral cancer and precancerous conditions and lesions in such individuals as well. Also, because of the various barriers that are currently present between the healthcare providers, that is the dentists, and the healthcare seekers, that is the transgender persons, seeking positive oral health care becomes far from reality. So, a point of contact is extremely important for us to break this barrier so that both these communities come together and render service and seek service as well. Also, a lot of transgender persons, because they undergo HRT or hormone replacement therapies, have an increased amount of gum bleeding and tooth bone related issues in the oral cavity. So, this is something which needs to be kept at check. If not, the person is at risk of losing the teeth. Also, regarding awareness relating to basic preventive measures of oral hygiene, such as how to brush the teeth or brushing twice a teeth, collaborating with communities to make a basic toothbrush and toothpaste available, liaising and coordinating with community based organizations to facilitate and integrate these movements in general healthcare and overall well-being is of prime importance in today's day and age. So because of risky behaviors, because of increased amount of tobacco consumption, we see issues in the orodental structures, not only in the soft tissue paradigm, but in the hard tissue paradigms as well. There's increased amount of tooth decay, there's increased amount of tooth wear, which is seen due to supari chewing or because of increased amount of stress levels which causes grinding in such individuals. Tobacco consumption, of course, leads them to a higher risk of developing precancerous lesions such as leukoplakia and precancerous conditions such as oral submucous fibrosis, and leading, if unchecked, progressing very fast to the oral cancer paradigm. Also, certain issues during hormone replacement therapy, which causes pyogenic granulomas or small tumor-like lesions on the gums, is something which is commonly seen. Though benign in nature, but these are something which need to be anticipated and due diligence need to be given towards the same. So, enforcing both the preventive as well as the curative paradigm into transgender oral health care, the Kartavya Foundation has been initiated, which serves to be India's first unique, targeted, and focused intervention to provide basic oral health care in the curative and preventive modalities for the transgender persons. So not only does it bridge the gap in between the oral healthcare providers and the oral healthcare seekers by rendering preventive and curative oral health services to the transgender persons, providing free dental checkups, free basic oral healthcare treatment for the transgender persons, free oral cancer diagnosis and screening, and also creating awareness regarding the basic tenets of oral health care, the 5 golden rules of how to maintain your oral hygiene and to carry forward good oral health practices. It also goes ahead and sensitizes the dental community and the dental professionals to integrate transgender care into their regular practices, to provide gender related health related information and transgender care information, what are the specific nitty-gritties that they need to take care whilst treating or providing care to a transgender person. This entire thing is a seamless marriage which cause a positive healthcare seeking attitude for the entire community. The Kartavya Foundation also collaborates with a lot of community based organizations, educational institutions all across the country to spread their wings and come under the umbrella to spread the good cheer around.